Thank you everyone for being here. You are here for Medi-Cal Basics with Disability Rights California. My name is Diana Schulach. I am the program manager at Family Focus Resource Center. We are a resource center that assists families that have children with disabilities, and everyone who works at Family Focus Resource Center is a parent of a child with a disability. So please contact us with any of your needs. We can help you find resources, show you when the next workshop is going to be, and we have 10 different support groups to help you out. So right now I'm going to turn it over to Raymond. Before I do that though, I just did want to let you know, please withhold your questions until the end of the workshop. We will pause the recording and have a question and answer period at that time, but we don't like to record questions. So please, if you don't want to forget your question, just go ahead and feel free to go ahead and put it in the chat. And then we will cover those questions at the end of the workshop. So I'm going to go ahead and turn this over to Raymond from DRC now.
Thank you, and thank you for having us here again. My name is Raymond. I am an advocate with Disability Rights California. So just a real quick overview of who we are and what we do. We are a statewide nonprofit, and we provide legal services to people with disabilities with any disability-related issue. We have offices statewide, and our attorneys and advocates can help with different subject matters such as access or discrimination with housing, with transportation, with education, which includes special ed and higher ed. We can also help with public health benefits such as Medi-Cal, in-home supportive services, and Social Security overpayment issue that relates to work. And within our agency, we also have separate programs such as our Office of Client Rights Advocacy, or OCRH. They specialize in helping clients of the regional center, and our Client Assistance Program, or CAP. They specialize in helping clients of the Department of Rehabilitation. So I want to draw your attention to the chat real quick. If you'd like to have a one-on-one appointment with one of our advocates, please feel free to call our intake line. It's 800-776-5746. And our phones are open Mondays, Tuesdays, Thursdays, and Fridays from 9 a.m. to 3 p.m. If you call us outside of those hours, you can leave a message and our advocate will get back in touch with you as soon as possible. So without further ado, I am going to pass it over to our presenter today, Maria Ariate, one of our senior attorneys. Thank you.
Thank you. Good morning, everyone. So as it's been said, we're talking about Medi-Cal Basics today. Medi-Cal is a very complex program, so I'm keeping it very basic. If you have any particular, like if you want to talk about a case you have, it's probably best for you to contact our intake line. You could you can have general questions today, but if you start going into details, it's better that you contact us. So we're going to talk a little bit about give you background information on Medi-Cal so it all kind of makes sense. Medi-Cal Eligibility Basics, kind of hard to talk about because every Medi-Cal program, and there are many in the state of California, when I show you the aid codes, you're going to probably very, very surprised. There is not one Medi-Cal program. There are many, and each Medi-Cal program has its own eligibility criteria. There are a handful of programs where disability is a requirement, that the person be disabled to get Medi-Cal. But just because you have a disability doesn't mean you can only use, the handful of programs. Even if you have a disability, but you qualify for another Medi-Cal program, well, you can be placed on that program. I'm going to take you to a website where you can see more or learn more about the programs Medi-Cal programs where disability is a requirement. I'm going to talk briefly about Medi-Cal services, what happens when you have Medi-Cal and other healthcare, applying for Medi-Cal, and some updates that have been. CalAIM has been around for a number of years, but there continue to be changes through the CalAIM initiative, and we're going to just briefly go through it. There's a lot going on in the Medi-Cal world. So let's talk about agencies and terms. When you hear Medicaid, It's the same program in California, but California decided to call its program Medi-Cal. Other states call their program something else. The majority kept the federal name for this public health program called Medicaid. It's a needs-based program, so they are going to look at income. And one Medi-Cal program, the one that's linked to SSI, will look at income and resources. The federal agency that administers both the Medicare, which is another public health benefit program, and the Medicaid program is the Centers for Medicare and Medicaid, so CMS. The Department of Healthcare Services here in California is the single state agency responsible for administering the Medi-Cal program. It can delegate to other agencies some of its work. So, for example, in-home supported services is a Medi-Cal service. So you have to have Medi-Cal in order to apply for IHSS. But that program is administered through the California Department of Social Services. So DHCS and CDSS entered into an agreement that that would be the case. But ultimately, DHCS is responsible for everything that happens or doesn't happen in the Medi-Cal program here in California. When California decided that it wanted to participate in the Medicaid program, states don't have to. It had to submit a state plan to CMS, basically describing what the program would look like here, who would be covered, what services would be covered. There are mandatory services that need to be covered in California. So hospital coverage, doctors, and some other things. But a lot of the services that California offers are optional. It doesn't have to offer them, but it does. There have been times where California has decided not to cover some of those optional programs, mainly when there are budget cuts or budget concerns. So CMS approved the state plan. And so then California started to receive federal money for many of its Medi-Cal programs. In order to receive that money, the state had to agree to follow federal laws, regulations, guidelines. So federal law, regulations, guidelines are supreme. California has its own laws, regulations, and guidelines for the Medi-Cal program, but it cannot be more restrictive than the federal law. It could give more than the federal law, but not restrict more than the federal law. If you want to look at the state plan, it's this link here. So there are Medi-Cal programs where the federal government helps pay for the service, the thing that you're getting from Medi-Cal. And we call that federal financial participation Medi-Cal. But there are Medi-Cal programs where the federal government does not pay anything, and those we call state-only Medi-Cal programs. So we have federal financial participation Medi-Cal programs and state-only Medi-Cal programs. So there are two delivery models in the state of California. You're either in fee-for-service Medi-Cal or you're in managed care. I think I saw some numbers recently that said that about 90% of people who have Medi-Cal are in a managed care plan. Fee-for-service just means that you can go to any doctor, any Medi-Cal provider in the state of California. When you're in managed care, you have to be part of a health insurance company that is the managed care organization for Medi-Cal. In some counties, there are multiple Medi-Cal managed care plans. In other counties, there's only one. So for example, if we go to Orange County, I'm going to open up this map so that you can see what I'm talking about. So this map here, as of January of 2024, these are the different managed care models in California. Here, if we go down to Orange County, it's in gray. It's a COAS model. So there's one managed care plan. So a lot of the plans up in Northern California are partnership. And in Orange County, it's CalOptima. But some counties have two plans. So if I'm in a two-plan model, I get to choose from two Medi-Cal managed care plans, and I can move from one to the other throughout the year. Some plans, like Los Angeles, has I think 4 or 5 different plans. So although it says two-plan model, there's more than that in Los Angeles. I think even Riverside and San Bernardino have more than two available. So depending on what county you live in will depend how many Medi-Cal managed care plans you get to choose from. So that was the first link. And by the way, you're going to get all of this information and you can look it up. That was the first link that I opened up, but there's more information on these different models in these links below. With regard to Medi-Cal services, you're either going to have full scope Medi-Cal or restricted Medi-Cal. Full scope just means that you have the ability to ask for any of the services supports that are in the state plan. So in-home supported services, nursing home care, community-based adult services, that's adult day health care, waivers, durable medical equipment, all kinds of things, transportation to and from your medical appointments. Restricted means that it's restricted for a certain thing. So maybe there may be someone who didn't have Medi-Cal, goes to the emergency room, qualifies for Medi-Cal, for restricted Medi-Cal to cover everything related to the emergency, and then it ends. No more Medi-Cal after that. Pregnancy related long-term care, if you go into a nursing home, that could be restricted. So there is a really good publication, and I've left it in the link here, more about the difference between restricted benefits and full scope benefits. And when we look at the aid code list later, you'll see that some Medi-Cal programs are full scope, some will say restricted. And so those are the two service delivery. So I'm sorry, those are the two services. It's either full scope or you have restricted Medi-Cal. So Medi-Cal is a very rich program as far as the services that are available. And I'm just going to open up the first link so that you can. These are essential health benefits, but just so that you can see just how much it covers: outpatient services, chiropractic, dialysis, hospital outpatient, emergency services, hospitalization, maternity and newborn care, mental health services, substance use disorder, drugs, dental, vision, all kinds of therapies, durable medical equipment, hearing aids, home health. That's when a provider will go to the home to do a task and then leave. Like sometimes for home health, you'll have a nurse come in and check your blood pressure or do catheter services. You might have a physical therapist come to the home to provide therapy. That's when you can't leave the home. So that's home health, laboratory services, all kinds of preventative and wellness services, pediatric services, enhanced care management. I'm going to give you a link to more of this, but this could, for people who are high need Medi-Cal members through your managed care plan, you might be able to get enhanced care management. Transportation services, yes, you can get transportation services to and from your doctors through Medi-Cal. and what they call long-term services and support. So you can go into a nursing home, you can get waiver services. Those are waiver services are under the umbrella of home and community-based services. All kinds of things. This is not an exhaustive list of what Medi-Cal covers, just the essential benefits. And then, let's see, I need to go back to the presentation. And then we have, and NHELP is an organization that does work throughout the nation, and they have a really good guide on Medi-Cal services that you may want to look at. Now, it doesn't matter whether we're talking about private insurance or public health insurance. You can't just ask for something and expect to get it, because at a minimum, you'll have to show that what you're asking for is medically necessary. And every health insurer has its definitions of what medical necessity is. So Medi-Cal has a definition for adults. What's medically necessary is you're going to have to show, and this is through your providers. You don't show it, your providers show this, that what you're asking for is reasonable and necessary to protect life, to prevent significant illness or significant disability, or to alleviate severe pain. That's the criterion you have to meet for medical necessity as an adult. For children and young adults under the age of 21, the medical necessity standard is much broader. All you have to show is that what you're asking for is necessary to correct or ameliorate a defect, physical or mental illness or condition. And there's even a different medical necessity standard for people who are in nursing homes. So EPSDT stands for Early Periodic Screening, Diagnostic, and Treatment. So children and young adults under the age of 21 who have Medi-Cal are not subject to limitations that are imposed on adults with regard to therapies. So I'm making this up, but let's say that Medi-Cal says you can, as an adult, you can only have 2 physical therapy sessions a month. And that's all that you're going to be able to get through Medi-Cal. But anyone under the age of 21, if you show that that you need 5 days of physical therapy a week, and it's medically necessary, then that person needs to get it. And just if you want to know more about EPSDT, there are guides here that you can look at. That's why when someone who's been on Medi-Cal as a child, young adult, turns 21, all of a sudden they don't have all those benefits that they used to. And they wonder, well, what happened here? Now, my condition didn't change. It's because now you're considered an adult and there's a different medical necessity standard. And you're subject to the rules. Now, along with, medical necessity, there might be other criteria that you have to satisfy to get the service or support. So, for example, if you're asking for a wheelchair, well, not only do you have to show medical necessity, but there's a long list of other things you have to show in order to get that wheelchair. So we're going to stop talking about services for now. We're going to look at some eligibility basics as best as I can, because like I said, there's so many programs and every program has its own criteria for eligibility, but I can talk generally about things. There is a Medi-Cal that you get when you are getting SSI. That's the money benefit from Social Security. And we call that Medi-Cal categorically linked Medi-Cal. It's categorically linked to the SSI. So when you lose your SSI, you lose the Medi-Cal that comes with the SSI. And at some point, if that happens, you're going to get a letter from the county saying, hey, we hear that you're losing your Medi-Cal because you're losing your SSI, but we're going to see if there's any other Medi-Cal program you qualify for. In the meantime, you'll continue with your Medi-Cal, And then you'll get that second letter saying, hey, we found that you qualify for this Medi-Cal program or that Medi-Cal program, or it might be you don't qualify for any other Medi-Cal program. And at that point, your only recourse will be to appeal. And so when we're talking about the categorically linked Medi-Cal, income will be important and countable income will be important and resources will be important too, because it actually follows the SSI rules. Other Medi-Cal programs, the only thing they're interested in nowadays is just your countable income. They don't care what resources you have. That was a change that happened a few years ago. But remember, each program has its own rules as to what all these Medi-Cal programs look at, and so does the SSI-linked Medi-Cal. They start with your gross income, and then they tell you what you can deduct from gross income to get to countable income, because the countable income they compare with the ceiling dollar limit for each Medi-Cal program. And as long as you're below that ceiling, you'll qualify. If your countable income is above that ceiling, you will not qualify. So when I used to do casework and someone called me about Medi-Cal and they weren't on SSI, I did have to ask, well, I had to say to them, because no one really knows what Medi-Cal I mean, honestly, 99% of people don't know what Medi-Cal program they're on if they're not on SSI. And so one of the things I had to do was figure out what Medi-Cal program they were on. And so what I would do is I would call the county Medi-Cal office and ask, what program are they on? Every Medi-Cal program has an aid code. I've been told, I haven't done this, that you can go to a pharmacy and they can, scan your card and tell you what aid code you have for Medi-Cal. And if you have the aid code, you can look up the aid code in this document that I just opened up. So every year it's updated. And so we've got, I'm not even at the top of the page here. There are like 70 some odd pages of aid codes. So you can imagine how many Medi-Cal programs there are, right? But so we start with aid code 01. It's the Refugee Resettlement Program, Cash Assistance Program, Full Scope Medi-Cal, no share of cost. There's a Medi-Cal program called the Medically Needy Program where you could have a share of cost. And let's say that I have a share of cost of $1,000 a month. So what that means is that I have Medi-Cal, but if I want Medi-Cal to kick in, I have to pay out of pocket $1,000 in healthcare costs, dental, vision, pay my IHSS provider perhaps. That amount, $1,000 a month before Medi-Cal kicks in. If I don't meet my share of costs that month, I don't have Medi-Cal for that month. And it goes like that month to month to month. So anyway, so knowing your aid code, you'll know what program you're on. And and then that way, if you call an agency, someone who does this kind of work, at least they'll know where to start, right? They could do it too, but I'm just saying that I think, like more than 70 pages of aid codes. So I just wanted to show you, and for example, full scope, you see full scope, full. So far, these programs are full. And then I know we'll find a restricted because they do exist. But so far we have full restricted. Here's a restricted. So due to pregnancy. So anyway, so this is a program that's restricted. So it'll cover pregnancy-related care. And once pregnancy is over, there's no more Medi-Cal for this person. And that's the way restricted works. So let's go back to, and this is where you get the aid code, and the aid codes change every year. So we were looking at the 2025. aid code. Okay. SSI and income. So generally income is considered, money is considered income the month you get it. Anything that's left over that into the following month becomes a resource. So if you're getting SSI and you're trying to save money in your bank account, that money is income in the month you get it, and whatever's left over converts into a resource. And for the SSI program and the Medi-Cal categorically linked program, because it follows the same rules as SSI, you can only have $2,000 as an adult. You can only have $2,000 in countable income. As a married couple applying for SSI, you can only have $3,000 in countable income. Of course, there are things that don't count as. I'm sorry, I'm talking about resources. For the SSI program, the resource limit is $2,000 for an adult, $3,000 for a married couple that's applying for SSI. But so when we're talking about income, it's money that in the month you get it, whatever's left over becomes a resource. And people get into a lot of trouble because they don't understand the rules. I had a caller who had been saving, she was on SSI, had been saving money. She hadn't been spending all of her SSI every month and had accumulated over 5 years money in her bank account. Well, the SSI program got wind of it 5 years later and sent her a letter saying, oh, you've been over resourced for the last 5 years. You need to return all that money. We're suspending your SSI. And of course, she was going to lose her Medi-Cal. And who knows what if Medi-Cal paid anything in those last 5 years. There might be a recovery there too. There are what we call lump sum payments when you're on SSI and you receive a lump sum payment like a retro IHSS award, an inheritance, a retroactive IHSS award. They give you more time to spend the money down before it becomes a resource. And so this link that you see here, we'll talk about that. So categorically linked Medi-Cal, resources, and countable income will be important. Okay. And these links just tell you that for the other Medi-Cal programs, not the categorically linked program, resources don't matter. Now, if you have SSI and you're limited to $2,000 in countable resources, but if you have a CalAIM account, this should be 2025, by the way. Lonnie I forgot to change it. It's $19,000 for this year. You can put into your CalAIM account up to $19,000 a year. And if you're on SSI, you can have up to $100,000 in your CalAIM account, and it will not affect your SSI or your categorically linked Medi-Cal. So it's a great way to save if you qualify for a CalAIM account. And there's more information if you go to this link about that program. Immigration status doesn't matter anymore for Medi-Cal. Of course, it does for SSI, the categorically linked Medi-Cal. Just think of SSI and the Medi-Cal that comes with it as a different bird, right? But this bird here, all these other Medi-Cal programs, they don't care about your immigration status anymore. But despite the fact that they don't care anymore, remember, every Medi-Cal program has its own Medi-Cal eligibility rules. So you still have to comply with that stuff. And so there's links here that tell you all of this. For people who have not become lawful permanent residents, so far, it can change. Medi-Cal benefits generally do not affect your ability, well, they're not considered in the public charge determination. So when you are applying for lawful permanent residency, the federal government is going to see if you would be considered a public charge. And so usually it's receiving money, money benefits from a public agency, not Medi-Cal, except for what you see here. If you're in a residential nursing home or a mental health institution, then that's possible. There's more information in this link about public charge. I'm not an immigration expert, so if you're concerned about whether you should be applying for public benefits based on your immigration status, you really need to talk to an immigration attorney. Earlier, I said to you that there are a handful of Medi-Cal programs where disability is a requirement. It's a criterion along with other things to get onto the program. Except for Magi. Magi is just different. I'll explain it in a moment. But there are Magi and non-Magi modified adjusted gross income Medi-Cal programs. So the programs that you see here are those programs where disability is a requirement. Except for the aged and disabled, you can be aged or disabled, right? And so there's a lot more information on db101.org, and you're going to have the ability to go there. I'm not going to go through all of these. I just want to show you what it looks like. So income-based Medi-Cal is that Magi Medi-Cal. It came into effect around Obamacare, and there are certain people who can qualify for Magi depending on, where their accountable income is, and their age, and this is the first program that came around that I know of where resources didn't matter for the Medi-Cal program. So you can have a disability and qualify for Magi. Perfect. As long as I qualify for Magi, I qualify for full scope Medi-Cal. I don't care. Honestly, I don't care. I really don't care what program they put me in, as long as I get full scope Medi-Cal and I don't have a share of cost. So that's really, for me, what would be important. So this is the Magi program, and it tells you, what you can deduct from your gross income to get to countable income that you can compare with the different age groups and the federal poverty level you need to be under. And then we've got Medi-Cal for people with disabilities. So we've got the Aged and Disabled Federal Poverty Level Program. I've talked about the SSI-linked Medi-Cal. 1619B is for people who lose their SSI because they're not because of work. They can continue with their Medi-Cal through 1619B perhaps, or maybe through Medi-Cal's Working Disabled program. And then we've got the Age Blind to Disabled Medically Needy program. This is the program that might give you a share of cost. So anyway, so they go on to describe each program, what the countable monthly income is. So if I'm applying for the Aged and Disabled Federal Poverty Level program, my countable income after deductions has to be less than $1,800 a month. A couple applying, $2,433 a month. And then it tells you, find your total countable income by using Social Security rules. And then they tell you what other things you can deduct from your gross income to get to countable income. And that's how each program works. Each program is going to tell you, okay, from gross income, these are the things that you can deduct. Okay, so let me go ahead and go back to, and this is the link to db101.org. You can go. But I've also provided you with a link to a manual from Western Center Law on Poverty on Medi-Cal eligibility. It's a fabulous manual. It came out in 2016. So all of the numbers in there are based on federal poverty levels as they existed in 2016, but I've also included the 2025 federal poverty levels so that you can use the manual and the federal poverty levels, the current ones. Obviously, there have been some changes since 2016, also like with immigration, with resources. So the manual may be a little outdated on some stuff, but it, for the most part, is pretty current. I want to talk about Medi-Cal deeming. So if you're a minor applying for Medi-Cal, or you're a spouse applying for Medi-Cal, or you've been sponsored. So let's say my sister, I wanted to become a lawful permanent resident, and she sponsored me. She signed documents with the federal government saying that she would take care of me for a certain period of time, that I would not become a public charge. And I turn around and I apply for Medi-Cal. Well, deeming applies to these three groups. So a minor applying for Medi-Cal, the income of the parent with whom the minor lives will be counted as if it were the minor's income. A minor will also might have his or her own income, like child support. Maybe the child inherited a trust from a grandparent and is receiving money. That would be income. But in any event, that's deeming. The SSI program also has deeming, but the difference between the SSI program and Medi-Cal is that there's a way to get around the deeming, and it's called waivers. So there are a number of waivers in the state of California, some like the Home and Community-Based Alternatives waiver, the Home and Community-Based waiver for the developmentally disabled. You may know that as the DD waiver. Self-determination program is also a waiver. And there are other waivers in the state of California where the waiver itself has language that says, if this person qualifies for this waiver, then you, Medi-Cal eligibility worker, will pretend that this person who's applying lives in an institution. Because if the person lives in an institution, there's no deeming, right? Because deeming applies to the parent with whom the child lives, the spouse with whom the spouse lives. So that's really the only way to get around deeming. So there are kids who do not qualify for Medi-Cal under the general rules, but they happen to be, for example, regional center clients, and they qualify for the DD waiver or the self-determination waiver, and therefore Medi-Cal will not look at the parent's income. Like I said, the child may have his or her own income that they will look at, but not the parents. So that's really the only way to get around deeming, is getting someone on a waiver where the waiver allows for institutional deeming. If you want to know more about waivers in California, waivers are just a waiver is a service, another Medi-Cal service. I do a whole presentation on waivers, but in any event, you can look at the current and some of the former waivers in the state of California by going to the link below. So if you get Medi-Cal, you get Denti-Cal too. There are, of course, for adults, there are services, and they may differ from adults' services for kids. For the most part, in most counties, except for Los Angeles and Sacramento, you can go to any Denti-Cal provider. If you're in Los Angeles County or Sacramento County, it works more like an HMO. You have to be part of a plan. So more information there in that link. You also get vision care. You can go to this link and find more information on that. So what happens when you have Medi-Cal and other health coverage? Medi-Cal is always payer of last resort and will only pay for expenses that it covers, and that other coverage will not. So if I have private insurance, Medicare and Medi-Cal, then the way that it'll work is that my private insurance will be billed first, or I've had and pay or not pay. Then it'll go to Medicare, and then finally it'll go to Medi-Cal. A child, if a child has private insurance through the parent's employer, perhaps, then private insurance you need to go to private insurance first, see if it covers it or not, and then show Medi-Cal that it doesn't cover, for example, before Medi-Cal will kick in. When you're in a Medi-Cal managed care plan, you can only use the healthcare providers that are in the plan. You cannot go out of network unless the Medi-Cal managed care plan allows that to happen. So if what I've seen happen is that sometimes people will use their private insurance to go to certain doctors who are not Medi-Cal providers for certain things, and then use the Medi-Cal for other things. But you always have to show, and Medi-Cal requires that you provide all insurance information. Because remember, they're payers of last resort. So sometimes it gets really hard to try to get services and supports when you're having to go here, there, and everywhere before Medi-Cal will. And if you're in a Medi-Cal managed care plan, then you've got to stick within the network that you've chosen. Can go out of network, but you have to get permission from the Medi-Cal managed care plan. It becomes complicated. When people have both Medicare and Medi-Cal, for example, you can have your Medi-Cal managed care plan take over your Medicare, so it's all under the umbrella of your Medi-Cal managed care plan. Why? Because there's just easier care coordination. You don't have to go to your Medicare and deal with that before you get Medi-Cal kicks in. It's all under one roof, and that's a possibility for people who have both Medicare and Medi-Cal. So lastly, I wanted to talk about CalAIM. It started in 2022. It's called California Advancing and Innovating Medi-Cal. The goals of these improvements, changes, are the ones you see here, to make sure that there are better health outcomes for people, that services are more standardized and equitable, to ensure that people who need the most help get it, and for the first time is combining some services that are non-medical, that could include respite, personal care, meals, housing, and I'll talk about that in a bit. So some of the changes, there are many things that are happening. There's no way I could talk to you guys about CalAIM in the time that we have, but I've given you links so that you can look at all of the stuff. So some of the changes were Medi-Cal managed care plans are paid to cover certain services. If the Medi-Cal managed care plan doesn't cover, then Medi-Cal will cover it, but not the Medi-Cal managed care plan. You have to access that service or support in another way. So in January of 2023, now skilled nursing facility care is under the umbrella of managed care, meaning they're responsible for covering certain levels of care. For other levels of care, then Medi-Cal still covers it, but you have to access the service in another way. All specialty mental health services you get through county mental health, but it's still covered by Medi-Cal. There were people who were required to enroll in managed care who used to not have to be in managed care. One category of people were people who had other health coverage. They were exempt from going into managed care. Now it doesn't matter. And there were people who were in managed care who were allowed to move out of managed care and into fee-for-service. Yeah, so I showed you the map of counties and the different managed care models. So that map is current. And these are just some categories of people who were required to enroll in managed care. Enhanced case management. For people with complex health needs, your managed care plan is required to provide this service. There are links that talk to you about the service, so please read the information. And if you think you qualify for enhanced case management, call your managed care plan and get that rolling. Community supports, also known as in lieu of services, are things that the managed care plan can offer that are not medical in nature, such as housing, food, community transition services, etc. Managed care plans are not forced to do this, so you can learn more about it, but if you want to know if your managed care plan is providing any of these services, you need to contact your managed care plan and find out. There were some new dental benefits that came out. This link down here gives you more information on CalAIM. And this is the dual, when you have Medicare and Medi-Cal, what the different options are for you, including having your Medicare under the Medi-Cal umbrella for better care coordination. So you can look up that information. To apply for Medi-Cal, the first link will talk about the different ways to apply for Medi-Cal, but I'm really interested in showing you the Benefits Cal, because through Benefits Cal, you can apply not only for Medi-Cal, but for other programs that the county administers. You can upload documents. You can reach out to your caseworker, communicate to them through the Benefits Cal portal. So the county administers more than just Medi-Cal. I'm going to show you all the programs they administer: CalFresh, Disaster CalFresh, Medi-Cal, of course, County Medical Services, CalWorks, General Relief, Refugee Cash Assistance, the Trafficking and Crime Victims Assistance Program, Welfare to Work, Cash Assistance Program for Immigrants. So if you want to apply for any of these, you can apply online. And what you do is if you haven't created an account, you can create an account. You put in your information and create an account. It's going to ask you for a series of things you need to put in, create a username, create a password, etc. Now you're registered and you can go online and apply. So why would I want to go to the county welfare office to apply when I can just do this online? I know some people are not comfortable using the computer to do these things, but this is just another way to do it. If you're comfortable using a computer, this might be the way to do this. I don't know about you, but I've been on calls trying to reach someone in the county, like for IHSS or Medi-Cal. I've been on hold for 55 minutes, over an hour, only for someone to answer the phone and say, I want to talk to the person, or leave the person a message. And they say, no, we can just take a message and we'll have them call you. I give them my information. Do I ever get a call back? Not always. So this is a good way also to communicate with your caseworker. You can manage your benefits, explore resources, apply, upload documents. So maybe when your Medi-Cal is being reassessed every year, if you need to submit new documents, you can do it that way. The way that you do it is you take a picture of it and then you upload it. Yeah, but anyways, it's there. And then resources, that manual I talked to you about is excellent. Here are the 2025 federal poverty levels. Health Consumer Alliance, they help people with their different like Medi-Cal issues, but they also have resources online. Healthcare Options is a place to go if you're not quite sure if you're in Medi-Cal managed care or fee-for-service, or what you have. Do you have Medicare? Is it Medi-Cal that you have? You're not quite sure. They also help you different languages. Let me get it to English. They help you if you are to understand what's available through your managed care plan, or if you have the ability to choose among different managed care plans. They can, and you say, look, these are my needs. They can help you try to figure out which Medi-Cal managed care plan is best for you. So there's some changes. They help you choose a Medi-Cal plan, dental, compare different plans, find a provider, etc. So a good resource for you guys. Okay. There's the Managed Care Office of the Ombudsman. So if you're having trouble with your Medi-Cal managed care plan, you can contact the Ombudsman's office. We also have a number of publications online. One of them is your how to grievances and appeals through managed care. We'll put the link for that publication in the chat. Very helpful publication to know about. And so we've come to the end of the presentation. We're now going to stop the recording and happy to take questions. If anyone needs clarification, comments, all good. Thank you, Maria.